So testosterone flu, what do you think?
I was under the impression that testosterone flu was from bad quality, like underground steroids. I thought it was from injecting things that were contaminated, because if you inject something that is not sterile and not clean into the body, you will get subjective immune system responses. And if we're looking at flu responses, I mean, the symptoms of the flu is the immune system responding. So I would take those things as meaning that your body is reacting badly to the compound. Now, I would also argue that the individual could be allergic to the carrier oil. That does happen like 1 in 100 times. It is rare. I've seen a couple of guys react badly to everything, but again, we're looking at the 1 in 100 thing. But when it comes to testosterone flu, I would say that it's a negative reaction to non-sterile, poor quality underground steroids or underground testosterone. Or it could just be a response to someone doing their first injection of testosterone, and it can be psychosomatic as well. That's a big one as well. Guys need to realize that when you do take your androgens up, it stimulates the central nervous system, and how you respond to central nervous system stimulation is based on the individual. Some people may perceive that as anxiety. If you have an autoimmune condition, it could ramp up the immune system as well. So there are lots of things intertwined here. People shouldn't downplay the effects of their psychosomatic responses to things. But yeah, I don't think that in general, testosterone flu, as in flu from pharmaceutical grade bioidentical testosterone, is that a thing?
Yeah. Someone wrote, is your body's immune system reacting to foreign hormones being injected into your body? Yeah, especially if they are not pharma grade. I guess if they are contaminated, of course, you can get some feverish reaction.